In the United States, more than 24 million people have diabetes. That's nearly 8% of the population. Joining us today is Dr. Herb Rettinger. He's the president of the Endocrinology Medical Group of Orange County, and he's here to discuss what you need to know about diabetes. Herb, thanks for coming.
Oh, my pleasure, Larry.
And you've been involved with this your whole life. You're the vice president of the California Association of Endocrinologists, and I know you're one of the most leading endocrinologists around, and we've worked together for many, many years. As a cardiologist, I see the ramifications of this disease on my patients. Why don't you explain to us what diabetes is and how you make the diagnosis now?
Sure. And you're right, Larry. Diabetic patients are very, very prone to cardiovascular disease. As a matter of fact, that's our primary issue in making the diagnosis early and treating our patients to avoid a visit to your very fine office. We define diabetes as elevated blood sugar in the fasting state above 126, and after eating, or 2 hours after eating, of greater than about 180. And you mentioned 23 million diabetics in the United States. That's growing by 3,500 patients a day in the United States.
That's amazing.
And we have what we call pre-diabetic population, which in the United States is about 57 million. And those are patients that have blood sugar levels fasting between 100 and 126, which puts them in the mildly abnormal range, or after eating greater than 140 but less than 200. So it's a big population, all right.
So if somebody wants to be screened and they say, they want to know, do they have diabetes? What's the best way to approach it? Should they get one of these glucose tolerance tests? What is the best test that they should get?
Well, the first thing is a suspicion by the healthcare provider or the physician if they're going to see their primary care physician. Patients that have diabetes in their family are at high risk. Any non-Caucasian ethnic background puts you at a higher risk. Abdominal obesity puts you at a higher risk. Patients that have frequent infections probably should be checked. And women that have had large babies or had gestational diabetes or elevated blood sugars during pregnancy should be checked. And sometimes it's just as simple as a random blood sugar in the doctor's office or a more formalized specialty test using a glucose drink in the morning and having 1 or 2 quick blood tests done.
The glucose tolerance test, is that what
well,
you're
it's an
referring to?
abbreviated, much kinder glucose,
shorter one, yeah.
Much kinder.
Yeah. So there's other tests that you do to measure diabetes, like the hemoglobin A1C. Can you explain what that is exactly?
Oh, glycohemoglobin or hemoglobin A1C is a test that I think every diabetic patient or family member has heard about. And essentially it's a summary test. And it tells us over an 8 to 12 week period what the blood sugar averages have been. Now, we don't use it to make a diagnosis of diabetes because it's kind of like a grade point average in college. So you can have a B average and that means 4 A's and a D. So it just tells us kind of where you've been, but not when and what day your levels were high or low.
So this is a single blood test that measures glucose control or blood sugar control for a month or so?
Actually for 2 to 3 months.
2 to 3 months. So a patient who doesn't have diabetes shouldn't go in and demand this test from their physician?
No, it's helpful to have a negative test, but there's a broad range of low. If someone usually is at a level of 4.5 and they come in at 5.8, that's still normal per lab, but it's higher than they used to be. So a single test may not be as useful as possibly getting a blood sugar.
Now, in my career, diabetes, the treatment has just seemed to expanded dramatically. There's so many tools, so many drugs, so many different things. So if somebody's diagnosed with diabetes, are they put on medications right away, or does it depend on their blood sugar? How do you? Well, I know it's a complex question, but
yeah, we get asked that question all the time. Usually, if it's mild, nothing more than some behavior modification is needed. We call it TLC, for therapeutic lifestyle changes. So we have patients that come in and say, you know, I only eat 1 meal a day, and that's like the freeways being empty the whole day, and then at rush hour, every car in LA tries to get on. So we try to change that to more frequent, smaller meals. And if we can get patients to exercise and lose a little of the abdominal fat, sometimes that's all that's necessary, and we don't need to write a prescription at all.
I see you have some interesting tools here, and I know it's getting complicated. Why don't you tell us what these nice looking devices are? What's this one
sure.
here?
This one here is just a very simple and representative glucose monitor. There are about 6 or 8 of them on the market, and they're relatively inexpensive. It allows our patients to check their blood sugar at home, something we didn't have 10 or 15 years ago, and has just advanced our diabetes control and management dramatically.
And it still requires a finger stick, though.
But it's a painless finger stick.
One, yeah.
And we use the side of the finger, Larry, where there are very few sensory nerves, but a lot of blood. And we require the teeniest of drop of blood. So it really fits into everybody's lifestyle. It takes 5 seconds to get the result. Simple, easy, quick, and painless.
And tighter blood sugar control, is that correlated with less complications from the diabetes?
Oh, absolutely. Matter of fact, if we can keep the blood sugars as close to normal as possible, our major goal, you know, is to keep cardiologists wondering where their patients are.
Well, don't be too good at this.
No, well, we're trying. We're trying.
And what is the next device you have there?
Well, you know, frequently patients do have to go on insulin. We have some wonderful, wonderful oral agents now. We understand the physiology of diabetes so much better. But there are times when the type 2 diabetic, and type 2 diabetics make up 90% of our diabetic population, and those are the patients, Larry, that still make some insulin but have some degree of resistance to the insulin. But somewhere along the line, it's frequent that patients need to go on insulin, and we now have insulin pens that allow you to just turn a handle and put in the right amount of insulin. And I want to show you something, Larry, because it's amazing. There is the needle. I'm going to hold that up if you can see it. This is a painless way of giving insulin. I'll leave that here in case the camera wants to get closer to it. And these have made our lives so much easier.
I imagine that's dramatically improved compared to drawing it up and measuring it.
So much simpler.
That's great. So what is, and the next device is?
This device is a representative of one of the many wonderful insulin pumps that we have available for patients that require insulin. And what it does is it gives a small amount of insulin almost on a minute-to-minute basis. And you can program this and tell it when to give bolus amounts of insulin to cover meals or to help bring down blood sugars.
Bolus meaning another little extra injection to, because the blood sugar goes up after a meal.
That's exactly right. And this has enabled patients to have much more freedom. Most of them are waterproof. You can wear them in the shower, wear them at night sleeping. And it has just allowed our patients tremendous freedom and ability to control their diabetes and pretty much prevent our complications as much as we can.
So smaller than a pager almost, really.
Oh, it's wonderful. They're wonderful and easily usable. Anyone that can use a computer or a little iPhone will have no trouble using an insulin pump.
That's great. And the last funny looking device, what is that?
Oh, yeah, this last device here I brought in. This is something new, Larry. It is a continuous glucose monitor. These are made by a bunch of different companies, and this allows us to measure blood sugar every 5 minutes and transmit the result either to a pump or to a monitor that the patient carries. And there are actually now a few companies that are manufacturing these, and they give us trends. They actually show us if the sugar levels are going up, sugar levels are dropping, and
that's fantastic.
The monitor screens have alarms put in them that you can set yourself. So if the sugar levels are dropping too quickly, an alarm goes off. Sugar levels go up too quickly, an alarm goes off. Gives our patients lots more freedom and lots more confidence in using insulin.
Wow, that's fantastic. That's amazing technology. We're almost out of time here. So it looks like people, if they have diabetes, they can do something about it.
Absolutely.
They can get to somebody like you, and you have some great devices that can protect them and have them live a long, healthy life and
absolutely,
and keep them from cardiologists.
Well, this is a disease that now is much more livable. It's easier, and patients become educated, and the physicians and specialists will help them out, and they're not alone, and they can live a good, healthy, long life, and just takes a little bit of effort on their part.
Fantastic. Thanks so much for coming today. I learned a lot. I didn't know you had some of those devices. I appreciate it.
Lots of gadgets and more on the way.
Great. Thank you so much.